I have two really interesting cases for you guys today. My name is Rhys Barber. I'm one of the audiologists here at Audiology Associates. Now, they both have a very similar theme. So the theme running through these two patients is skin removal, okay? So make sure you stay tuned for both because they kind of lend quite well to one another. Now, what's going on in this particular ear canal here? Now, at first glance, I thought this was a little bit of wax, but actually it's not. This is a mixture of wax and quite hardened keratin, so dead skin that's dried out, dehydrated and gone really tough as old boots. So that's what we mean by keratin. Now the skin's job is normally to migrate out of the ear canal, carrying dirt, debris and wax along with it. But what's happened in this particular case, and it's kind of compounding itself a little bit here, is this patient has a case of keratosis obturans. Now, with Katie's video the other day, thank you very much for being really kind to Katie as well, as it was one of our first videos to do. But you guys were saying, well, it's actually quite nice to have someone asking questions about, you know, we throw out these terms and sometimes it's really difficult for you guys. I assume you guys know it, but you might be new to the channel, you don't. So keratosis obturans, let me get rid of this mouse. The skin inside the ear canal, imagine it growing like a conveyor belt. It's trying to always get to the outermost portion of the ear canal to come away really easily. Now, what happens in this case is it kind of stays in situ and dehydrates and hardens up, and that's what we call keratin. Now that's what we've got at the base of this canal. Now with keratosis obturans, what happens is those layers of dry, hardened skin add to one another. So what that effectively does then is you've got this ever widening plug of skin and it starts putting pressure on the canal walls, okay, which causes a kind of like a chronic inflammation, if you like, in there. Now, what can happen in extreme cases is it causes the bone around the ear canal, the bony portion of the ear canal, to start what they call resorption. So basically, it just starts almost wearing away of the bone tissue, if you like, that bone diagram. And what can happen with these particular ear canals is you start to get almost like a ballooning, a widening of the canal wall. So it starts to look much, much wider than it should do. Now, if that happens to the whole ear canal, we talk about ear canal remodeling, which is basically where it just kind of forms this much, much wider canal overall. If it happens in a specific portion, a more kind of, one area, centered around one area, it's called dehiscence. And that's what we've got here is ear canal dehiscence. Now, what you'll see at the bottom is I've hit this really tough, hardened up piece of skin here, and it's sitting right at the base of the canal. And I'm trying to remove this. You've got to be really careful because with these patients, this canal is really, really sensitive. We talked about that chronic inflammation. So what we've got is almost like a little bit of a puffiness to the skin in the canal here. And when we try and peel this away, it makes the ear canal ultra sensitive. So what I've popped in here is some medical grade olive oil. Don't forget, you can't use ordinary olive oil if you're putting it in your ears. You need to look for olive oil that's been filtered, sometimes been treated a little bit as well. So always look for a medical grade olive oil. You can get it from pharmacies. If you check out the link tree in the description below, there's actually a link to, it's like an Amazon affiliate link. There's some olive oil on there that you guys can get, which works really, really well in the canal. But what I'm doing here is I've used the oil to soften this up a little bit, okay? So we're just going to lift this last portion. You can see I'm really trying to peel this away. And when I take this away, check out the bottom, the base, okay, the inferior, the bottom portion of the ear canal. That's the most common place you're going to get this kind of dehiscence going on, that kind of not erosion, but that kind of formation of the bone, or widening of the canal. Look at that. You've got almost like this little divot just inside. You can see where it kind of, the ear canal slopes down, and then you've got that little bit of a kind of a dip in the canal there. And that's what I'm talking about, this pressure from that skin almost causing this kind of, this I want to steer away from the word erosion because it's kind of like almost like a relaying down of bone, but in a different place. So it's that kind of divot that's formed with that bony portion of the canal there. Now, what you do have to be really careful of with these patients is you've got to keep a close eye on them, because what you can get sometimes is as that skin tries to come away, what you saw there is it collects in that little kind of, that little dip in the canal there and it forms, and then what you'll get is you're more likely to get something called an ear canal cholesteatoma, which in itself can cause problems, and that will cause this bone erosion then, and it can become quite nasty as well. You've got to be really careful with those, so it's something you need to keep an eye on. That lighter material you can see around that 1/2 centimeter mark, that was just that layer that we took away from the base of the canal. Told you it was an interesting case, didn't I? Now this patient, we've on a very similar ilk. Now, you've actually seen this patient on the channel before. This patient has a very similar issue. So what we get here is we get this collection of skin in the canal. Now, luckily, this patient, we identified this with this patient, and this patient comes through every 3 months. So bear that in mind for the ruler shot at the end. This is 3 months worth of skin. Now, wax, if you were getting a patient back and forth with a wax issue, then I'd say the average for most patients is about every 12 months thereabouts. With skin issues, much, much quicker. But don't forget that skin is constantly being my goodness, I can't speak today, replenished and refreshed. So what you end up with is a lot more skin, and it builds skin plugs much, much quicker. Now, normally it takes a long time to get this plug out, but this patient, actually this time they've actually oiled their plug for about 4 days beforehand. And what we can see here is we're just pulling on this back section. So I want you to think about this now. We've got this skin that's forming in place. It's hardening up. It's starting to expand out. So exactly the same as the last patient, but it's happening all the way around the canal. It's putting pressure all the way around rather than just one specific spot. So I've got the crocodile forceps in here, and it never comes away. This is the last time this gent was through, I think he was sitting in the chair for about 25 minutes just to try and get this plug out. Today it happened in just a few minutes, but take a look at this as it comes away. 3 months, mind, okay? Take a look at this as it comes out. Here we go. You can see I'm struggling here. I'm just trying to get a grip on the edge. Look at that. Look how long and how chunky that plug is. It almost looks like, what's the American sweets? Candy corn? Candy corn. It almost looks like that kind of gradiated section, or if you're from the UK, a rocket lolly. If it's, I'm showing my age now. But what you're left with then, you can see that sort of mild inflammation. You look at the redness, the puffiness. You know, we're talking about this chronic inflammation underneath this this skin debris. What we're left with here, this is actually just a very wet, kind of almost oily patch in here. Now, why wouldn't I go in and irrigate this last bit? Because it's just very thin, mushy layer. They're sitting down over the eardrum. I do go in and try and tidy some of it up. But why do you think I wouldn't go in there and irrigate at this point? I'll give you a couple of seconds to think about it, and then we'll go through it, okay? So the reason that you wouldn't go in and irrigate this particular patient is look at all the inflammation in there. Look at all the redness in there around that drum as well. If you go in there and start putting water in here, what's going to happen is you're going to strip away all of those ears' natural defenses, okay? Now, I don't want you to get into your head that syringing is a bad thing to do. Syringing in the right hands and with the right type of wax is actually a really effective method for removing earwax, especially sloppy, kind of wet earwax. But in this case, what we don't want to do is introduce a lot of water in there, because what's going to happen is it's just going to sit, you know, if you get any remnants, we can try and suck as much of that as we possibly could, but you can end up with some remnants, and then you've stripped away all the ear's natural defenses, and you're going to leave that patient, in this particular scenario, you're going to leave that patient open to infection. You could use some ear calm afterwards, which will just help to, it's an acetic acid spray. So it's an acidic spray. Your ear canal likes to be slightly acidic, so it can help fight off bugs that try and get in there, any bacteria that's trying to take hold. So you could use an acetic acid spray afterwards, quite possibly, but would you really want an acid spray going on already, inflamed skin? You really wouldn't. So we're better off leaving that last little bit there, that very thin layer, because it would just be ridiculously uncomfortable to remove. Look at the difference though in this ear canal. Now this same patient, this is the other ear canal. We can see this very kind of thin, almost hardened up layer of wax in here. And this is just purely all wax and a little bit of skin underneath. But as I'm peeling this away, you can see the canal itself is very, very dry. But when we take this piece away, we use the forceps in a second just to get rid of this piece. Nearly. That's just at the wrong angle. I've just got to lift it with the bottom jaw of the forceps to be able to get this out. Once this comes out, you'll see we're looking at a very, very different ear canal on this side. So let's take a look. There you go. You can see that skin looks quite healthy. Eardrum, yeah, there's a couple of little retraction pockets. What do I mean by retraction pockets? I'm trying to be very aware of all this now. Basically, it's where you've got a portion of the eardrum where pressure acts a little bit more than it does middle ear pressure, or that the air pressure behind the eardrum acts a little bit more than it does on the outside ear pressure. So you get patches of the eardrum which is more susceptible to the pressure change. So you end up getting a little bit more kind of movement for those areas, and it causes these little dents in the eardrum, and that's what's known as a retraction pocket. Also something you want to keep an eye on. But look at that plug from 1 centimeter to just under 3, so a centimetre and a half of dead skin from the inch mark. What are we looking at there? Probably just over half an inch. What's that? Something like 5/16, no, not 5/16. Well, I can't, down to 5/8 of an inch. That's what I was trying to say. So you got that much built up in just that short period of time, 3 months. Absolutely crazy. Told you they were interesting cases, didn't I? Yes, I did. I think Katie is going to be back for you tomorrow. In fairness, Katie and Taylor did record a voiceover for the members video for tomorrow, but the sound went a bit kooky, so I'm going to see if I can fix that. If I can't, you'll have me back again tomorrow, just in case the voice that went over. Just to keep you aware, it's a skin ribbon tomorrow. It's a good one as well, so it might be worth sticking around for that one. I'm totally jealous because I love a good skin ribbon, and I didn't get this one, unfortunately. But as always, guys, thank you very much for watching our video today. If you do enjoy the videos, you can always like, heart, share, follow, and subscribe for me. And if you thoroughly enjoy the videos, you can also consider becoming members of the channel. That way, then you get to see even more wax removal videos every single week. But until the next video, guys, as always, take care of yourselves, take care of your ears, and really importantly, take care of one another. And I shall see you in the next video. Bye, everybody.